Hey guys, let us talk about nephrotic syndrome and nephritic syndrome, which are basically glomerular diseases. The first thing to be noted over here is proteinuria, which is basically selective and mainly albumin is responsible. And here we have proteinuria and hematuria, but albumin is not selective. The appearance of urine here is whitish, frothy, and foamy. You can see the amount of froth present over here. Here we have Coca-Cola urine, and the name here refers to the color of the urine. Lipiduria, fatty cast, less or no lipiduria, no hypertension, and hypertension. Now, these 2 points are important to know because they may give you a history of a person with hypertension in your exam questions. So we have no hypertension with lipiduria and fatty cast and nephrotic syndrome. Here we have gross proteinuria more than 3.5 grams per day, less proteinuria less than 3.5 grams per day, therefore called as subnephrotic proteinuria. So here we have again more edema, basically due to loss of more albumin, and here we have less edema. And in nephrotic syndrome, we again have dyslipidemia, and do not forget the lipiduria over here. In nephritic, we don't have dyslipidemia. In nephrotic, we again have loss of protein C and protein S causing thrombosis risk. And in nephritic, we don't. In nephrotic, we have pure immunity and a high risk of infections. And in nephritic, there is a less chance of infections. Now, the thing to be noted over here are the most common causes. In children, the most common cause of nephrotic syndrome is minimal change diseases. In adults, it is focal segmental glomerulonephritis. Now, the thing to be considered over here is that the overall most common cause of nephrotic syndrome is diabetes mellitus. And focal segmental glomerulonephritis can only be considered if diabetes mellitus is ruled out. In nephritic syndrome, on the other hand, in children we have post-segmental glomerulonephritis as the most common cause, and in adults we have Buerger's IgA nephropathy. This is what you should know about the difference between these two conditions, and do follow for more updates. Thank you.